Let's start with the fifth and final section of our lecture, and in this we will discuss mainly the prognosis of tetanus, how we can prevent the tetanus and the immunization available for the tetanus. Prognosis of the tetanus, recovery from the tetanus, as we went over in detail the pathophysiology, how the microorganism or the bacteria, clostridium tetani, enters the body through wound, infection, abrasion, laceration, produce the neurotoxin that enters the nervous system, cause the presenting feature, which is the spasm of the or hypertonia of the skeletal muscle. So all that takes about ultimately 4 to 6 weeks, and after that the degradation of the toxin occur, and then there is slow recovery of the condition. So recovery takes about 4 to 6 weeks from the tetanus. Patient must be given a full primary course of immunization. As tetanus toxin is poorly immunogenic, immune response following natural infection is inadequate. Rapid development associated with more severe disease and poor outcome. We talked about the severity of the illness. We have mild disease, which is not as bad. Prognosis is good. Moderate disease also, prognosis is good. But in severe illness, the prognosis is poor. Because of the severity of the illness, there is a spasm of the skeletal muscle. And in the severe disease, we mentioned there is respiratory failure, there is cardiovascular instability associated with hypertension and hypertension alternating. And then we have respiratory failure. Endotracheal intubation is difficult because of the spasm of the muscle, rigidity of the head and neck. And then there is a tracheostomy should be performed, and then prolonged tracheostomy itself has so many other complications. So prognosis with the severe illness is not good. Recovery is typically complete unless complications. High incidence of neurologic sequel in neonates and children. So neurological complications are common. Higher incidence is present in the neonates and children. So unless there are complications present, recovery is typically complete from the tetanus. Neonates are at increased risk of learning disabilities, behavioral problems, cerebral palsy, and deafness. All these are different neurological sequelae that can occur in children and newborns, like cerebral palsy, behavioral problem, deafness. All these features can occur. Factors associated with poor prognosis in tetanus, we divide them into adult and the neonates. In adults, if the age is more than 70 years, prognosis will be poor. Intubation period less than 7 days. Short time from first symptom to admission. Purpural, IV, post-surgery burn entry site. Period of onset less than 48 hours. Heart rate more than 140 beats. Systolic blood pressure more than 140. Severe disease or spasm. Temperature more than 38.5. All these are associated with poor prognosis in the adult. Incubation period is the period from the entry of the microorganism and the appearance of the first symptom. So if that is less than 7 days, then the prognosis is poor. Neonatal tetanus, young age, premature birth, incubation period again less than 6 days, delay in hospital admission, grass used to cut cord, low birth weight, fever on admission. So all these are the poor prognostic factors for the tetanus. Next, prevention. How we can prevent the tetanus from occurring? You can see these are the kinds of wound. In this, there is laceration of the skin and there is abrasion, and once it is infected with the clostridium tetani, it can cause tetanus, especially in the parts of the world which are underdeveloped and then where there is more chances to develop the tetanus. Good wound care is important in the prevention. Immunization is also important for prevention. Safe and clean delivery. Lot of underworld countries where there is increased nowadays also there are more deliveries performed in the home with how midwives and they don't have special hygienic circumstances where the deliveries are performed. The instruments are not very well sterilized and clean. There are more chances that there is maternal tetanus occur. 2 doses of tetanus toxide at least 4 weeks apart to previously immunized pregnant women. So 2 doses of tetanus toxide 4 weeks apart. Immunization dose of antitoxin TD1, 2, 3, 4, 5 when to give at the first contact or as early as possible in pregnancy. Expected duration of protection, none. TD2 at least 4 weeks after TD1, 1 to 3 years is the protection time. TD third is at least 6 months after the TD2 or during subsequent pregnancy, 5 years of protection. Fourth dose is at least 1 year after TD3 or during subsequent pregnancy, 10 years of protection. And fifth dose at least 1 year after TD4 or during subsequent pregnancy. So it's important that if we cannot give it routinely after 1 year. At the time of pregnancy, we should give the TD4 and TD5. That concludes our topic tetanus, in which we covered in detail all the aspects of the disease known as the tetanus and how it is caused, what's the pathophysiology, causative agent, and how it grows and develops, and what are some diagnostic tests available for the diagnosis of tetanus, and how we can prevent, and what's the prognosis of the tetanus. So thank you for watching sqadia.com.